Now, many doctors and other NHS staff are still too fearful to expose malpractice, even when they fear for patient safety. So tomorrow, a campaign is being launched to try and give whistleblowers more protection. At its forefront is the paediatrician Dr. Kim Holt, who sounded the alarm about problems at the hospital unit which later failed to spot baby P's injuries. In tonight's special report, our health and social care correspondent Victoria MacDonald spoke to another healthcare worker who blew the whistle and was then sacked.
Shamala Chowdhury was once a radiology manager here at Ealing Hospital in West London. All she can do now is look from the outside in. She has been effectively locked out, sacked, after she blew the whistle.
One day we actually had a really sick A&E patient, and the consultants within A&E couldn't find a radiologist to get advice, and I looked at the roster and there were supposed to be consultants there, and then after looking even further, I discovered that they weren't at the hospital. They were actually working at a private hospital while still being paid by the trust.
So all this was times when they were at the private hospital?
Yes.
And these were when they should have been? This is a serious allegation. Two consultants moonlighting, it's alleged. The trust says an investigation was held and was found to be unsubstantiated. But it's what happened next that is of such concern. Miss Chowdhury, the whistleblower, found herself falsely accused of fraud.
I was marched off premises. I managed 60 staff in the department, you know, and nobody could understand what was going on. It was really humiliating. I was confused. I didn't know what was going on, because when they said, they couldn't tell me the details, except they said, they believe I'm committing fraud. And I said, well, what is it? They couldn't tell me.
Where was the bit that you cross-referenced it with? So far, she has won an interim tribunal. The trust was told to put her back on full salary. And last February, she won her appeal against the sacking. No fraud was found. But the trust still refuses to take her back. The fact is, Ealing Hospital isn't that unusual in the way it's dealt with this case. It is all too common across the NHS for the whistleblower to be punished. And while the Health Secretary, Andrew Lansley, has promised to give them much more support, there are many who believe that he hasn't gone far enough. Paediatrician Kim Holt was put on special leave after she raised concerns about safety at a Great Ormond Street hospital clinic in North London, the same clinic where a locum allegedly later missed baby P's injuries. Now Dr. Holt, who has been reinstated, will tomorrow help launch a campaign to better protect whistleblowers.
Well, what we're really asking for is a change in the culture. So whistleblowing shouldn't really be necessary. What we should be able to do as health professionals is raise concerns within a department, within a team, and it's discussed and addressed at a sort of early level. And we shouldn't really need to have this escalation, which we're seeing on a regular basis now. We're seeing, undercover reporting, and we're seeing exposés in the press because people aren't being listened to.
Following baby P, Dr. Holt was offered £120,000 to leave and to stay silent. She refused. The hospital has always said it was not an attempt to gag her. The Public Interest Disclosure Act is meant to protect whistleblowers, but it isn't working. Last year, Channel 4 News revealed that NHS managers continue to use taxpayers' money to buy the silence of doctors and other staff. In other words, to gag them. And the new campaign, Patients First, wants this stopped. With this in mind, they've already launched legal action against Ealing Hospital and one other trust over their handling of whistleblowing cases.
Our hope is that the NHS Trust will agree to make changes to their policies, that they will agree to recognise this as a real issue. They'll agree to take steps, as they have to under the Department of Health guidance, to make sure that their whistleblowing policies are effective, they're proper, they're comprehensive, and they give doctors the confidence to raise concerns when those concerns need to be raised.
In the meantime, though, Shamala Chowdhury has now been away from a job she loved for 2 years. She has more than £100,000 of legal fees. She's in danger of losing her home, and she cannot persuade anyone else to employ her. Now they know she's a whistleblower.